Good morning. My name is Debbie Harrison, Program Officer, Healthcare Workforce Development at HCI. And today I'm going to give an overview of the scholarship programs. Our scholarship programs help support students who are dedicated to providing direct patient care in underserved areas of California in exchange for a 12-month service obligation. Our goal is to increase the number of appropriately trained health professionals providing direct care in underserved areas. For the Allied Healthcare Scholarship Program, applicants must be currently accepted or enrolled in an allied healthcare program, some of which include community healthcare worker, dental hygienist, medical assistant, pharmacy technician, respiratory therapist, surgical technician, and ultrasound technician. The others are listed on this slide. As well as the following professions, which are specific to behavioral health: behavioral disorder counselor, certified nursing assistant, home health aide, marriage and family therapist, mental health counselor, occupational therapist and occupational therapist assistant, psychiatric aide or psychiatric technician, rehabilitation counselor, substance use disorder counselor, and social worker. The maximum award amount for non-behavioral health professions is $15,000 and $25,000 for behavioral health professions. An applicant may receive full, partial, or no funding based on the applicant's success in meeting the selection criteria and the amount of funding available. Applicants will not be awarded more than the total cost of attendance for 1 year of the program and may be awarded up to 3 times. Grantees will receive a one-time payment at the time their contract is executed. For the Advanced Practice Scholarship Program, applicants must be currently accepted or enrolled in one of the following programs. Non-behavioral health professions include certified nurse midwives, clinical nurse specialist, dentist, nurse practitioners, pharmacists, physical therapist, physician assistant, and speech therapist. And the behavioral health professions include occupational therapist, psychiatric mental health nurse practitioner, and psychiatric nurse. The maximum award amount for advanced practice is $25,000. An applicant may receive full, partial, or no funding based on the applicant's success in meeting the selection criteria and the amount of funding available. Applicants will not be awarded more than the total cost of attendance for 1 year of the program. Applicants can apply as many times as they would like, but can only be awarded up to 3 times. If awarded, grantees will receive a one-time payment at the time the contract is executed. Eligible facilities must be in one of the following eligible geographic or site designations: health professional shortage area, either dental, primary care, or mental health; primary care shortage area, or PCSA; state health facility, county health facility, children's hospital, correctional facility, Native American Health Center, rural health care center, an FQHC or federally qualified health center, a veterans facility, or public school facility. To be eligible for scholarship programs, the applicant must start their program by October 1st, 2022, and must be enrolled in and maintain a minimum of 6 units and a GPA of 2.0 or greater until program completion. Applicants must graduate after June 30th, 2023, and be free of any other service obligation, including other HCI programs, and must not be in breach of a previous HCI contract. They must also commit to providing a 12-month service obligation in a medically underserved area or facility and provide 32 hours or more direct patient care per week after graduation. Those who are interested in submitting an application for the scholarship programs must complete an online application through our EAP funding portal and include one of the following required documents: a certification of enrollment form, a cost of attendance for 1 year, and a conflict of interest letter. If awarded, grantees must submit a graduation date verification form 30 days after graduation, in addition to an employment verification form at the time of employment. Grantees will have 6 months after graduation to find employment at an eligible site. Over the course of the 12-month service obligation, 2 progress reports will be due, which must be signed by the grantee and their supervisor. The progress report certifies that the grantee is maintaining the required 32 hours or more in direct patient care per week for the given reporting period. Any changes regarding employment, for example, a change of work site or hours, must be reported and approved by your program officer and will require a new employment verification form to be submitted. A grantee is allowed up to 4 weeks if they require time away from their practice site. If the absence exceeds the allowed time, their contract must be amended, which will extend their service obligation end date to make up for the additional time missed.
And that concludes the scholarship programs. My name is Cherise Frisch, Executive Assistant with Healthcare Workforce Development Division at HCI. Interactive participants may raise the hand icon there at the top. You'll be placed in queue. I'll call on you by your first and last name, and you will need to unmute yourselves. Chat option is disabled due to the volume of attendees and those with dial-in only option. If you have any questions, as well as those that we are unable to get to your questions, feel free to email the address on the question slide and we will respond after the webinar. James Burke has your, you may present your question.
Yes. Hello. So is this applied to a bachelor's program in psychology leading to the master's program to ultimately be a therapist, a marriage and family therapist?
Michael, do you want to jump in on that one?
Yeah, can you restate the question?
Yeah,
Sorry.
so if I were to apply for a scholarship, would it apply to a bachelor's program in psychology? And then the goal would be to go to the master's program and then ultimately get licensed. But I was just wondering if you go as low as the bachelor's program.
Right now, the lowest that we do offer is a licensed vocational nursing. And then the career path to that is the registered nursing, and then into your graduate programs.
Right, but psychology is different.
Yeah, we don't have a scholarship.
Okay.
Yeah, specifically for psychology.
Okay, good to know.
Thank you, Michael.
Erica Green has a question. Go ahead, Erica, if you'd like to unmute yourself. Erica, if you'd like to unmute yourself. On the three dots on the right of your name. Okay, so we'll go to Penny Schinken has a question for now, and we'll get back to Erica. If you'd like to unmute your mic, I've allowed the mic.
Yes, hi, thank you. I was wondering how it would be possible, if it would be possible, to add an additional behavioral health provider job role to that list of qualifying behavioral health providers. I do not see behavior analysts on the list, and they are a highly needed profession right now in the state of California and across the country to provide behavioral health services to primarily individuals with autism, but many folks as well.
That's a great question. We'll be happy to look into that for you. If you could please email that in detail to the hwddsch@hchi.ca.gov.
Will do. Thank you so much.
Thank you.
And Sandra Acuna has a question. And if you'd like to hover over your name, you'll see the three dots to unmute yourself on the right.
Okay, thank you. I just wanted to see, just to double check, are medical students able to apply for either of those scholarships?
I'm sorry. Are medical students?
So like osteopathic or allopathic medical students?
No, I do not believe so.
Okay. Thank you.
You're welcome.
And next we have Leanne Duffy. If you would like to, yes, hover over your name, unmute yourself.
Hi, can you hear me?
Yes, thank you.
Okay, I just wanted to ask and clarify if nursing students are allowed, like bachelor's in nursing students.
We have another scholarship program for BSN.
Okay.
But that wasn't included in this presentation. This was only specific to advanced practice and allied.
Okay, cool. Thank you.
And
You're
Janelle Cummings has a question. If you'd like to unmute yourself. If you hover over your name, and you'll see the three dots for the unmute. If you hover over Janelle, your name, you'll see the 3 dots at the right. To unmute yourself, you just click on. And I've allowed your mic. Okay, we'll come back to you. So we have Rio. First name Rio. Oh, it dropped. Okay, so back to Erica Green.
Hear me?
Yes.
Yeah,
Great.
so you don't hover over the 3 dots. You have to go to the top right of the screen. I looked at it, that's right. So I hope I'm not being presumptuous, but I was wanting to know about that, which I assume is going to be next, the loan repayment programs you have.
Yes, we're going to touch on 2 of the loan repayment programs after this.
Okay, so if I have any questions, so let me mute myself again. Now I know how.
Okay, thank you, Erica. Next, we have Amber Westfall, and you may unmute yourself.
Hear me?
Yes.
Okay, great. I'm just wondering, so there is scholarship available for SUD counselors. So my question is, are there any scholarship opportunities for counselors who are already certified who want to pursue higher education outside of social work?
Not at this time.
Okay, thank you.
You're welcome.
Okay, thank you for your questions. And there's the email. Please feel free to email the address on the question slide. We'll respond after the webinar. Oh, we do have a couple more questions. Are we going to? We'll go to Erica Rosen. You can unmute yourself.
Hey there. Are individuals only eligible, or could agencies apply on behalf of individuals and maybe award them internally, or is it just the individual that needs the scholarship that are eligible to apply?
That's a great question. It's for individuals.
Perfect. Thanks.
Thank you, Eric. And next we have Anastasia Gonzalez. You may unmute yourself.
My question is, I had to step away, so maybe it was already answered. But I want to know, is this program for drug and alcohol counselors who've done their bachelor? I did my bachelor's in social and criminal justice.
I can look into that for you. If you want to email the hwdd-sch@hki.ca.
Okay, thank you.
I can look into that for you and we'll get back to you on that.
Thank you.
You're welcome.
Thank you, Anastasia. Next, we have Nicholas Erickson. If you would like to present your question, you may unmute yourself.
Out of a kind of two-part question. One is, I was accepted into a master's program for counseling psychology and will graduate to become a professional clinical counselor. Do you need a license? Do you need a license in order to qualify for this first, or is it upon graduation? And then secondly, for the behavioral health, is it the possibility to be awarded 25,000 per year or 25,000 total over the course of the scholarship?
So you can receive up to 25,000 for behavioral health, and you can be awarded up to 3 times. You can apply as many times as you want, but you can only be awarded, you can be awarded up to 3 times.
Okay, thank you. And you don't need a license to be licensed therapist or counselor in order to qualify, right? Just need to graduate from the program and start working for one of the federally qualified healthcare sites.
That is correct.
Okay, thank you.
Okay, thank you. And are there any other questions before we go to the next slide? Okay. Okay, we have Embrae Tapia. If you'd like to unmute yourself.
Can you hear me?
Yes.
Okay. Just a follow-up question to that individual prior. So do you need to graduate only, or do you also need to register with the Board of Behavioral Sciences in order to apply for this program?
You will need to register, but you do need to graduate. You do need to
Both. Need both,
need
right?
the eligibility. You need to start your program and grad by October 1st and graduate after June 30th of 2023.
And register as an associate with the board?
I believe that is correct. Can somebody, Michael?
That is correct. So you will also need to meet the requirements of that profession. So if it does require you to be licensed or registered in order to perform those job duties at a qualifying facility, then those will need to be met. But after you do graduate, we do allow you time to complete those.
Okay. And one last question. How would an agency meet the criteria to get onto the list of the required facilities? Is there an application process?
Michael, were you going to answer that one too?
So for your facility, we do it based off of the address of the facility that you will be working at. And then you can also view our grant guides that are on the program's website. And we do list eligible designations and areas within California, as well as types of facilities that do qualify for that program.
Thank you.
Thank you, Embrae. Do we have any more questions for this scholarships program? Okay, one more from Sabrina Mahoney. You may unmute yourself. Sabrina, you may unmute yourself. The 3 dots on the right of your name, if you highlight your name. The mic is open. Okay, if you'd like to send your question to the hwdd-sch@hchi.ca.gov on the screen, we can answer after the webinar here. We do have another question from a call-in. If you'd like to present your question, I've allowed You're unmute, if you could unmute yourself. Oh, I have a mic as well.
Hello.
Yes, we hear you.
Hi. So I'm an MST student, and I will be graduating in July. And the BVS won't let you be fully licensed until 2 years after you graduate, and you're an associate in between that time. Can you apply for this scholarship as an associate, or do you have to be fully licensed?
I believe you can apply as an associate.
Okay, because on like the eligibility quiz, it has like a quiz for students and then it has a quiz for professionals. But if you're an associate, you're kind of like this weird in between phase, like you're neither.
Am I correct on that, Michael? They can be an associate.
That is correct.
Okay, and then also, I didn't see, where do you actually submit your application?
So we have a, if you look on our website, there's a funding portal. If you look on hcai.ca.gov, you will look under scholarships and then go to the one that you would be applying for.
Okay, 'cause I
You'll
see,
register. And
okay, it says application cycle open May 16th. Do I have to wait until then to do it?
yes, that is correct.
Okay, and then also, could I get that email that you said for people who have questions?
Yes, it's hwdd-sch@hcai.ca.gov.
Okay, and those first 4 letters were HWCD.
HWDD.
D as in Dave.
D as in David.
Okay, thank you.
You're welcome.
Okay, we have another question from Melissa Sleeper. You may unmute yourself for your question.
My question is, once I went to the website to check for my current employer to see if they're on the list, even though it brought them up, it didn't really give me any information whether or not it qualifies. It gave me some sort of like priority number, things like that. How do I actually understand if it qualifies?
You can always reach out to one of the program officers or send an email and we will check the site for you to make sure it's eligible.
Thank you.
You're welcome.
Okay, thanks everyone for all your great questions. And if you have any additional ones, please feel free to email the address on the question slide, and we will respond after the webinar.
Up next is Nadia Leslie.
Thank you, Debbie. Good morning. My name is Nadia Leslie. I'm a program officer with the Healthcare Workforce Development here at HCI, and today I'm going to give you a short overview of the Licensed Mental Health Services Provider Education Program, LMH for short. The Licensed Mental Health Program was established in 2007 to increase the number of mental health professionals practicing in mental health professional shortage areas and facilities in California. Awardees can receive a maximum award of $30,000 and can be awarded up to 3 times. HCI may award full, partial, or no funding to an applicant based on the applicant's success in meeting the selection criteria and the amount of available funds. Applicants will not be awarded more than their current total educational debt. Over the course of their 24-month service obligation, grantees will receive 2 equal annual payments. In order to be eligible to apply, LMH applicants must be currently licensed and/or certified and practicing in a mental health profession. Some of these are licensed clinical social worker, licensed psychologist, mental health counselor, psychiatric mental health nurse practitioner, rehabilitation counselor, and substance use disorder counselor. To be eligible for the LMH program, applicants must possess a valid and unrestricted professional license and/or certification to practice their profession in California. They must be free from any other service obligation, including from any other HCI programs, and must not have been in breach of a previous HCI contract. Applicants must have outstanding educational debt from a U.S. government or commercial lending institution and be able to commit to completing a 24-month service obligation where they will provide 32 hours or more per week of direct client care at a qualifying employment site in California. Eligible facilities include health professional shortage area, mental health, a publicly funded facility, a public mental health facility, a nonprofit private mental health facility that contracts with the county, children's hospitals, correctional facility, county health facility, public school facility, state-operated health facility, and a veterans facility. In order to apply, applicants must complete an online application through a web-based e-app portal, including uploading the required documents of an employment verification form, lender statement, conflict of interest letter, and proof of licensure and/or certification. Over the course of the grantee's contract, they will be required to submit 4 progress reports, which are signed by them and their supervisors, verifying that they are providing the required 32 hours per week of direct client care for the given reporting period. Any changes regarding employment, for example, change of work site or hours, must be reported to and approved by your program officer in order to ensure eligibility is maintained. Once approved, the grantee will be required to submit a new EVF. Grantees can take up to 4 weeks per calendar year away from their practice site for any leave of absence approved by their work. If their absence should exceed the 4 weeks, then their contract must be amended to extend their service obligation end date for the additional time missed.
Okay. My name is Sharice again, with Healthcare Workforce Development Division, HCI. Interactive participants may raise the hand icons for questions. You'll be placed in a queue. I will call on you. You will need to unmute yourself. Chat option is disabled due to the volume of attendees. Those in dial-in only option, if you have any questions, as well as those that we are unable to get to your question, please feel free to email the address on the question slide ahead there as you see, and we will respond after the webinar. So I see some questions. We have Kristen Flanagan. You may unmute yourself.
Questions actually. So on this one, as well as the scholarship one, you guys had said that you can be awarded up to 3 times. So my first question is, for every time that you're awarded it, do you have to do like the 24 months? So does it add up? Like if you got awarded it twice, would you have to do 48 months, or is it 24 months for the whole thing?
No, it'll be, so scholarships work a little bit different. They will add, you'll do simultaneously, You can, before you graduate, you can apply. And
Mhm.
then once you graduate, then you'll have the 1, 2, or 3 years stacked. On a loan repayment, you actually have to be done with your service obligation, and then before your next service obligation starts.
Okay, so that leads perfectly into my second question. My second question was, is, if we have already done that, can we use I've already worked in, that area for 24 months. Can I use that time I've already used or I've already worked to apply for it, or does it have to be future forward?
It has to be future forward.
Okay. Okay, thank you so much.
Thank you.
Thank you, Kristen. Next, we have Paradis Khosravi. If you would like to unmute yourself.
Yes, I have a question. So I was thinking about doing the public service loan forgiveness, which I know is a federal program, but I was wondering if I were to apply for this one and get like the 30K, do you guys know if that would mess up the public service loan forgiveness thing at all? Like, does it impact the other?
It should not, no.
Okay. And then the 30,000 is not, like, I know with the public service loan forgiveness, they very explicitly say that whatever is forgiven is not considered income in terms of like tax, like you don't have to pay taxes on it. Is the 30,000 a similar, like it's not considered income by the IRS?
We do not give out tax advice. Really, your situation is better that you speak to a tax consultant. That way they know your personal situation.
Okay, thank you.
Thank you.
Thank you, Paradis. And just a reminder for those on the phones with dial-in only option, or whoever else might like to email, our address is HWDD, so Harry Winter David dash LRP loan repayment program LRP at Harry C cat A apple I India .ca.gov. Okay, next we have Austin Nix, and you may unmute yourself.
I have a question. I work as a peer coach. Do peer coaches count? There's a requirement that they're certified. Do they count for the loan repayment plan?
They do not at this time.
Okay.
Thank you, Austin. Next we have Decinda Allen. You may unmute yourself for your question. Decinda Allen, if you'd like to unmute yourself, highlight your name with the mouse, and you'll see the unmute button on the 3 dots to the right. Okay, we'll come back to Decinda. So next we have Erica Green. If you'd like to unmute yourself. Erica, your mic is being allowed.
Unmute.
There you go.
Did it. Oh my God. So my question is that when you were talking about the qualifying agencies, I'm an LCSW and I'm a LADAC. I've been at this agency for about 4 years. So I think we are a nonprofit with a county contract. We went drug Medi-Cal, DMC, ODS. How do I find out if my agency is qualifying?
If you send me an email at the HWDD-LRP at HCI That'll
Okay.
go directly to us.
Okay.
We can qualify that for you.
Okay. I appreciate it. Thank you.
Thank you, Erica. Next, we have Gina White. Your mic is open if you'd like to unmute yourself. Gina White, if you'd like to unmute yourself for your question, the mic is open. Okay, we can come back if you'd like. Next, we have Michelle Blade. If you would like to unmute yourself for your question.
Hi. Can you hear me?
Michelle, yeah, sounds
can
great.
hear you.
Okay. Awesome. So my question is about, I understand under OSHPD, peers were eligible for the loan repayment programs. And from my understanding now, it's requiring something a little bit different because I don't see peers listed at all in any of these loan repayments or scholarships. Correct me if I'm wrong, but I'm wondering right now, I know that the main problem I find on the website is that we're going through the grandfathering process for certification for peer specialists right now. California just finally made it into law and they're starting to certify peers. Are we going to be eligible for this round of loan repayments or scholarships if we're going on for higher education, like graduate school, and we're peers working in the county?
Michael, do you have the answer for this question?
Not for the LMH program, but I believe we do offer a peer personnel program under HCI as well. That you may
Yeah, I don't think individuals are eligible for it though. I'm just wondering, do I need to have the certification because it seems like I could apply if I had the certification, but the certification just started. The application just opened a week ago, so nobody has the certification yet.
Yeah, for the LMH program, we would require the certification.
Okay, so once we get a certification, then we would be eligible.
Correct, as long as, yeah, you meet the program requirements and are in one of the eligible professions.
Okay, what if we're going to school? Like not the peer program, but if we go to like university and we're going to graduate school and we're also working for the county as a peer.
As long as you're working and still meeting the program requirements and providing the 32 hours of direct client care, you can still participate in the loan repayment program, even though you are in school.
Okay, great. Thank you.
Thank you.
Thank you, Michelle.
This is Jacinda. I found my mic.
Oh, great.
Good
Thanks. Go ahead.
Okay. So my question is, if you work for county mental health, however, instead of doing direct care services because you've already worked for the county for several years, and so now you're in admin, really overseeing the children's mental health authorization program. So you're working with your contracted clinics to provide direct care service, but you're not actually providing direct care services other than being the QI for under FFSPA. Does that count?
If you're supervising employees that are giving direct client care, it qualifies. If you're not giving first line supervision or doing the direct care yourself, then it does not qualify. That position does not qualify.
Okay. All right. Perfect. Thank you.
Thank you.
I found my mic now.
Oh, great. Thank you.
My question, a conflict of interest letter, I have no clue what that is, and I have very old loans. Does that matter?
It doesn't matter that the loans are old, just as long as you're still carrying a balance on the loans.
Okay.
The conflict of interest letter, we have templates in the application, and it's just to certify that you don't have a conflict with us. And that will be available in the application, the template that fits your situation.
Okay, thank you.
Thank you.
Thank you, Gina White, for your question. And next we have Melinda, and your mic is open if you'd like to unmute yourself for your question. So the three dots to the right, if you highlight your name to unmute yourself, Melinda, or we can come back to you. Okay, we can come back. So next we have Ambre Tapia, if you would like to unmute yourself.
Yes, I have a couple of questions. One is for registered counselors, SUD counselors. Are there any programs that they could apply for? And the reason why I ask is they need to be in school and provide, in order to re-register every year, they need to show that they're working towards their certification. They're not quite certified. They are providing direct care in county programs. Is there any type of loan forgiveness if they're taking out loans or scholarships available for them?
And what is the profession again? I'm sorry.
A registered registered SUD counselor, a substance use counselor, registered through the state of California.
The LMH loan repayment will work.
They don't need to be certified?
Is eligible.
They do not need to be certified. Is that correct? They can be registered?
That's correct. Right, Michael?
That's correct.
And then my other question is for non-direct services for individuals working in a program that they're not providing direct care. However, they support functions of providing direct care, either for the counselors, for the therapists, but their administrative roles. Is there any type of loan forgiveness program or scholarships available for those individuals that may be enrolled in school or completed a program?
So both, whether it's a scholarship or a loan repayment, there's two ways you can either, to complete your service obligation, you're either providing 32 hours of direct client care yourself, or you're supervising employees that are providing direct client care. If it's just administration, it doesn't qualify. But if you're supervising people that are providing the direct client care, then you would be eligible for either LMH or scholarships.
Thank you.
Thank you.
Thank you, Ambre. We have time for a couple more questions, and those on dial-in only. If you would like to email us, HWDD Harry Winter David dash LRP loan repayment program at HCHI. So Harry Cat Apple India .ca.gov. And next question we have Jana Lord. If you would like to unmute yourself. Jana Lord. Okay. We can come back. Violeta Garcia.
Can you hear me?
Yes. This is Janet. Oh, hi, Janet.
This is Janet. Hi, sorry. I have two questions. The first one is, how are you defining direct care? Is it limited to in-person, or is telehealth also applicable?
Telehealth is also applicable.
And so, okay. My second question is, are there any limitations on income?
No.
Thank you.
Thank you.
Thank you, Jana. We have time for one more question. Violeta Garcia, if you would like to unmute yourself. Violeta Garcia? Okay, you can email us. We'll on the screen there is available for emails after the webinar. We can answer. Austin Nix, if you would like to unmute yourself.
So just to clarify, in peer support specialists, once they're certified, they can register for the loan forgiveness.
Yes.
Okay. Yes. Okay.
Thank you, Austin.
Thank you.
So yeah, so there's the email here. If you have any additional licensed mental health questions, you can email hwdd-lrp@hcai.ca.gov on the screen here. So that's Harry Winter David dash license or dash loan repayment program or LRP at hcai.ca.gov. Okay, thank you.
Thank you. And now next up is Harold Sturber.
Thanks, Nadia. Great job and good morning, everyone. My name is Harold Sturba, Program Officer with Healthcare Workforce Development here at HCAI. I'm here today to discuss the Stephen M. Thompson Physician Corps Loan Repayment Program, or STLRP for short. I'll be referring to it such as that from this point forward. STLRP was established in 2003 to increase access to healthcare and promote retention of primary care physicians in medically underserved areas, or MUAs, of California. Our goal is to recruit and retain eligible primary care physicians by providing a financial incentive for them to be able to repay their educational debt. Applicants can receive up to $105,000 in exchange for a 36-month service obligation, wherein they provide direct patient care at a qualifying facility within a qualifying MUA. The maximum award amount for STLRP is $105,000, and HCAI may award full, partial, or no funding to an applicant based on the success in meeting the selection criteria and the amount of funds available. STLRP receives money or funding from multiple sources such as licensure fees, managed care administrative fines and penalties, special funds, and other donations. Applicants will not be awarded more than their total educational debt left on their loan balance, and applicants can apply as many times as they would like. However, they can only be awarded up to 3 times. If awarded, grantees will receive 3 annual payments over the course of their 36-month obligation. For an applicant to be eligible for STLRP, they must meet all the following eligibility requirements. They must possess a valid and unrestricted MD or DO license to practice their profession in California. Be free from any other service obligation, including from other HCAI programs. Must not have been in breach of a previous HCAI contract. They must have qualifying outstanding debt from a U.S. government or commercial lending institution, and they must have completed a 3-year residency. The applicant must be providing full-time medical services, and for STLRP, full-time is defined as a minimum of 40 hours worked per week, with at least 32 of those hours per week spent providing direct patient care on an outpatient basis. An exception to this would be for those practicing obstetrics, OBGYNs. Those physicians must also work a minimum of 40 hours per week, but they are required to provide at least 21 hours per week of direct patient care on an outpatient basis. Please note that outpatient basis means their patients are not admitted to the hospital. Eligibility for practice sites. For them to be eligible, it needs to be in a STLRP defined medically underserved area, or MUA. Per STLRP, those MUAs can be one or more of the following eligible geographic or site designations. So there's health professional shortage area, both primary care or mental health, a primary care shortage area, or PCSA, state health facility, county health facility, children's hospitals, correctional facility, Native American health centers, rural healthcare centers, or RHC, FQHCs, or federally qualified health centers, veterans facilities, or public school facilities. In addition to those geographic or site designations I just mentioned, the practice site must also qualify as one of the following STLRP practice settings: a community clinic, a clinic owned or operated by a public hospital or health system, or a clinic owned and operated by a hospital that maintains the primary contract with a county government to fulfill the county's role, which is in a MUA, and at least 50% of whose patients are from medically underserved populations. Or a physician-owned and operated medical practice setting that provides primary care located in an MUA with a minimum of 50% of patients who are uninsured, Medi-Cal beneficiary, or beneficiaries of another publicly funded program that serves patients who earn less than 250% of the federal poverty level. The applicant must work with their employer to identify which of those practice settings would apply to their facility. And the work performed in said practice setting must be clinical work in nature and not hospital work. Again, clinical work or outpatient basis, that is, patients must not be admitted to the hospital, whereas hospital work, which doesn't qualify, is on an inpatient basis and patients are admitted. Those interested in applying for STLRP during the upcoming application cycle must complete and submit an online application through the web-based HCI funding EAP portal at funding.hci.ca.gov. In addition to the online application, all of the following documents must also be submitted. You must submit an official HCI employment verification form, a lender statement showing outstanding educational debt from a qualifying lending institution, a conflict of interest letter, and copy or proof of your valid unrestricted MD or DO license to practice your profession in California. If awarded, grantees' contract will be monitored by their program officer and will require submission of 6 progress reports during their 3-year, 36-month service obligation. The progress report must be completed and signed both by the grantee and their supervisor, thereby certifying that the grantee is maintaining the required full-time, which is 40 hours a week with at least 32 hours of direct patient care on an outpatient basis for each given reporting period. And again, for OBGYNs, it would be 21 hours of direct patient care. Any changes regarding employment, such as a change of work site or hours, needs to be reported to your program officer, and they will need to approve that and verify it to ensure it's that you're maintaining your eligibility. And once that is approved and verified, it will require a new employment verification form to be submitted. If a grantee requires time away from their practice site, they are allowed up to 7 weeks away per calendar year for STLRP. And if their absence should exceed that allowed 7 weeks, then their contract must be amended, thereby extending their obligation end date to make up for that additional missed time.
Thank you, Harold. And now we have time, questions for STLRP. My name is Cherise Frisch again, and Executive Assistant at Healthcare Workforce Development Division at HCI. Interactive participants may raise the hand icon for questions. You will be placed in a queue. I will call on you by your first and last name. You will need to unmute yourselves. And the chat option is disabled due to the volume of attendees. And those with dial-in option only. If you have any questions, as well as those that we are unable to get to your question, please feel free to email the address on the question slide, and we will respond after the webinar. So the email address is hwdd-lrp@hcai.ca.gov. And questions, we have Dr. K. If you would like to unmute yourself.
Thank you for all this information. I actually am Stephen Thompson awardee. I won the grant like 3 years ago, something like that, after doing a year's worth of work. And I remember there were 3 installments. I just wanted to make a clarification. You said you could apply and win up to 3 times, or can you get up to 3 installments and that's it? Or can I apply again now?
No, so once your obligation has been completed, you can apply again and you can be awarded up to 3 separate times. So ultimately it would end up being, ultimately it would end up being like 9 years of a service obligation, because it would be the same thing again. It'd be another 3 years.
Of commitment. Okay.
Yeah. Yep. Correct.
Perfect. Thank you.
Yeah, absolutely.
Thank you, Dr. K. Any other questions for Stephen Thompson Loan Repayment Program? Okay, we have Laura McClellan. And if you'd like to unmute yourself for your question.
Hi, can you hear me?
Yes.
Yes.
Oh, good. I had a couple questions for the eligible practice settings. On the first one where it says community clinic and lists a few things, does the part that says located in a medically underserved area and at least 50% of patients who are from a medically underserved population apply to all those type of settings above that?
So those are each individual options within the same option, essentially. There are a couple of different categories within that one area, and you can just meet with your employer to go over those to make sure that one of them would fit the needs of your facility.
Yeah, we're a community clinic that is tax exempt, but I wasn't sure if the 50% of patients is required for each clinic that someone works at.
Michael, can you just help clarify that, please?
Yes, so that would apply to all those types of clinic settings.
Okay. And then my second question, we have a lot of doctors that practice OB as well. So where would they fall in as far as their patient care requirements? Do
So
they fall in? Yeah, go ahead.
For the OB, it would be, they still need to be working full-time, which is 40 hours per week. However, their direct patient care requirement is 21 of those hours per week need to be in direct patient care on an outpatient basis.
Okay, thank you.
Yeah.
Thank you, Laura. Any other questions for Stephen Thompson Loan Repayment Program? Again, also, if you'd like to email hwdd-lrp@hcai.ca.gov. And, but we do have time for some other questions if you would like to raise your hand. Okay, I don't see at this time. Oh, here we go. Dr. K has another question. If you would like to unmute yourself. Oh, there you go.
I think yeah.
Okay.
Hi. So one last thing, can you not apply until May 16th? Is there, because I'm on the website now and it's I don't know how to log in. I went through that portal link on the there's
so the application won't go live until the 16th at 3 o'clock.
Perfect. Okay, I'll do it at that time.
Yep.
Thank you, Dr. K.
Thank
Any
you.
other questions? Yeah. Any other questions that folks might have? Okay, well, here we go. We have Jean Ward has a question. And if you'd like to unmute yourself. Mic is open. If you'd like to unmute yourself, Jean.
Yes, thank you. I see it's open now. Okay, so my question has to do with the Allied Health loan repayment. I think I have been working with Harold. He's answered some questions before. I'm in my second commitment for Allied Health loan repayment. And so I forgot what my question was. God darn it.
You can feel free to email us, or if you've been in contact with me directly, then you can shoot me an email and I'd be more than happy to help out with that, since right now we're just talking about STLRP.
Okay, so don't ask about those things. Okay, no problem.
Yeah, no, it's okay. All right. Thank you.
Thank you, Jean. Any other questions for STLRP, Stephen Thompson Loan? We have time for one more question. One more question for Stephen Thompson Loan Repayment Program. If anybody would like to ask, otherwise you can email also at hwdd-lrp@hcai.ca.gov, and we will answer your question after the webinar. Okay, I guess this concludes the Stephen Thompson questions.
Thank you for your time, everyone, and for those questions. And now I'd like to turn things back over to Karen Rizel.
Thank you, Harold. Thank you so much for everyone that's attended today and for the opportunity that we've had to share information about our programs. As was mentioned earlier, we are opening all 4 of these programs on May 16th, and the application will be open until October 31st. During that time, however, we will be reviewing and scoring and awarding applications every 2 months, because we really wanted to be able to make awards more quickly. So we encourage you to apply and know that throughout this cycle, we will be making awards. We encourage you that for more information about the programs we reviewed today, to please go to our website and you can do a deeper dive. We will be posting grant guides and information about our programs for you to peruse as you prepare for potentially submitting an application. We also have what we're calling our eligibility tool. And if you would like to find out about additional programs that you might be eligible or your organization might be eligible for, we encourage you to go to that link for our funding eligibility tool. It will guide you through a series of questions and then share with you a list of programs for which you may be eligible. Also, if you would like to subscribe to our workforce programs update, we put out a regular publication to inform everyone, the public, about all of our programs, what's opening, what's on the horizon. And so we encourage you to go to that website. I believe it's on the next slide, the information for that mailing list. And as I mentioned earlier, we'll be posting this information to our website so you can follow up with us at a later time if you have additional questions. Thank you so much again for attending our webinar and teleconference today. We hope that it has been helpful to you. And we see one final question, and we do look forward to receiving your application. I see an additional question. I'd be happy to answer.
Okay. And Linda Ark, we have the mic open if you'd like to present your question and unmute yourself.
Yeah, can you hear me?
Yes.
Thank you so much for providing all this information. So I am currently a grad student, and possibly it looks like I qualify for actually 2 of the programs. So the Allied and the mental health. One is a scholarship and one is a repayment program. How do you suggest going about, like, can we apply to both? Or like, is there any way that we can get any advice on like which one to apply towards if we qualify for the 2?
We encourage you that when we make the grant guides available to take a look at that, and that will provide more information. Just as we probably mentioned earlier, that you can apply for multiple programs, but you may only receive an award for one of our programs at any one time. So we just encourage you to read the grant guide and determine based on more information that's provided in them. And you can always follow up with us in terms of following up in these email addresses if you have any additional questions.
Thank you. And we also have a call-in if you would like to unmute yourself. Okay. Do we still have a couple
Hi, can you hear me?
callers? There you go.
Hello?
Thank you. Yes.
Hi, my name is Andrew Hockman. Sorry, I joined this a little bit late, so I apologize if you've already covered it. I'm an associate clinical social worker, so I just graduated. I'm registered, but I went through the eligibility tool, and it's like asked if you're licensed, and I don't know if this is splitting hairs, but until so I have like 2 years post-grad pre-licensure, so I work under a registration number. Is that considered, because when I said I wasn't licensed, it said I'm not eligible. I don't know what the status is for like pre-licensed social workers. Does that make sense?
Yes, I do. I understand the question. Thank you for that. And I would have to defer to our program officers over the program, or I would just encourage you to please follow up with that on an email to us, and we'll be glad to investigate and respond.
Okay, and what's is your contact information on the websites or?
Yes, yes. If you go to hcai.ca.gov and you find the loan repayment scholarships and grants tab, you can immediately go down and it'll provide all the information about the programs and contact information. Yes.
Great, but I think I'm looking at the program for licensed mental health service provider education program. Is that the right one? Okay. All right. Thank you so much.
Thank you. We have time for a couple more questions if anybody has. And for those on the dial in on the phone, if you can go to hcai.ca.gov/mailing-list/ that you can also sign up, whoever would like to get on our mailing list. Any other questions? Oh, we have one more. Let's see. Your mic is open if you would like to unmute yourself. Looks like they dropped. Okay. Anyone else for questions?
Hello.
Hi there. We can hear you.
Hi. Thank you. My name is Katina, and also my apologies because I had to join in a few minutes late, so I don't know if it was covered. But is there a way to get basically this presentation? Is there a recorded presentation that I could access or maybe receive by mail?
Yes, yes. Thank you. We will be posting the slides as well as the recording for you to follow up later on our website.
Perfect. Thank you so much.
Any other questions? Please raise your hand if you have any other questions. Okay.
Well, I will go ahead and wrap up then. And again, we are so appreciative of the time that you took today to attend, and we look forward to you applying. And again, you can follow on with us with any additional questions later. Thank you again for attending.